My channel. My name is John. I'm your wellness coach, and today we're going to talk about low testosterone. So, most of what you know from hearing about low testosterone is that it occurs in men because we're the ones who have gonads. It causes some severe symptoms, some minor, some major, but we're gonna break all this down. Get ready to dive in, shall we? Here we go on fitness for your life. Okay, so for those of you who are just stumbling on my channel, welcome. My name is John. I am a wellness coach and personal trainer and a certified life coach based out of Pittsburgh. What I want to say first is low testosterone or hypogonadism, let's sound it out, is a very common disorder within the male population. So this is usually a higher prevalence in older men with type 2 diabetes, things like that. So an estimated 35% of men who are 45 years of age and up have if they have some sort of underlying issue like type 2 diabetes, obesity, things like that, you are probably a great candidate for low testosterone. Okay? But regardless of your status, we all are subject to have some sort of level of low T, because as we turn 40 and get older, our testosterone levels lower and they start to deplete. So this can bring on a multitude of symptoms. So what kind of symptoms are we discussing here? So let's just count it out. So we got one, we have lower sex drive. Number two is going to be tiredness, not to be confused with laziness. So if you're in a relationship right now and you're being accused of being lazy all the time, or you just don't want to do anything and you're very lethargic, there might be some other underlying issues. So if you haven't had your T levels checked, I would go to your PCP or your primary care doctor and just get those levels checked. Because you may be suffering from something that is totally treatable. So number three, you're moody, you're irritable, you're angry, and you really don't necessarily know why. You snap at people, you're very short with people. We get moody too, guys. And I am a firm believer that we get our time of the month too. We just don't have all the physical side effects, right? So raise your hands if you agree with me, and leave something down in the comments if you kind of see or have seen this moodiness trend, or with some of the other symptoms I described. Are you tired all the time? Are you lacking, libido or sex drive or something in that area? Those are three of the biggies. So to kind of, for those of you who don't or not or are not familiar, I need more coffee, excuse me. There we go. So for those of you who are not familiar with what low testosterone is, let me just spell it out for you. So testosterone is the main male hormone. We have 10 times the testosterone in our bodies than women do. Although I usually get a lot of questions from people that I train. Do women even have testosterone? The answer is yes. Yes, you do. You just don't have a vast amount of it for the specific and very I can't talk today, guys. For the very, oh my god, I can't think of that word. Obvious. There we go. For the very obvious reasons, you do not have an abundance of testosterone. So, testosterone, where is it made? Well, it's made down there, but also besides your testicles, testosterone is made by way of the pituitary gland when you are going through puberty. And this is where all those, hormones get started. And by the time you're 18, you are raring to go, and yeah, right. So, this is what provides us with erections, morning boners, stuff like that. It also helps us waft through our impulses, fight or flight responses, things like that. So testosterone is very multifaceted. It also helps in fertility in men. So if you have a higher level of testosterone, your boys are swimming all the time. If you're not, then you may have an infertility issue that you may need to go see an endocrinologist or a urologist for. So how do we diagnose low testosterone? Well, you go to your doctor or your PCP. They order a blood panel for you. So once you go get your testosterone drawn, here's what they check for. They check for free testosterone, total testosterone, and your levels of estrogen. What? Yeah, guys, we have estrogen too. Just, again, it's not as copious in amounts because we wouldn't have the visual statistics of being male. We wouldn't have body hair. We wouldn't have a lower voice. We wouldn't have a full set of external genitals, and so on and so on and so on. So some facts here. So let me back up. So when they draw your blood and they call you back in for the reading of the results with your doctor, so usually testosterone levels range is very wide. So normal T levels in men range from 300 to 1,000 deciliters. So this is a lot if you're on the higher end. So if you're on the higher end, all systems are working. You are awake, you're alert, you have better mood stabilizations, you have better sleep patterns, you are sexually active, and you're fertile. Now, if what is considered low, I don't know what the actual CDC says for what is considered low testosterone. However, let's just hypothetically say anything 300 and below. If you have below 300, you're going to experience some of or all of those symptoms that I was talking about before, right? So there are certain risk factors that we look for in men with low testosterone. Like I said, the drop in sex drive, the inability or loss of getting an erection. So you might be, you might have ED, erectile dysfunction, or you may just have full-blown impotency. So if you are experiencing that, I do suggest you link up with your primary care doctor and then have that conversation. It's not a very easy conversation to have on both sides, but it is one that's needed. And if you're embarrassed about it, your doctor knows about all this stuff already. They went to med school. They've gone through anatomy classes and all that stuff. You shouldn't be embarrassed. So you also have a lower sperm count. Your pecs don't look like pecs. They look like breast tissue. So that's called gynecomastia. You also have reduced energy, lower muscle mass, shrinking testicles. So if you're experiencing any of that, hike it to the doctor. Over time, low T can cause secondary symptoms. So loss of body hair, loss of muscle bulk, like I said, weaker bones, so you have osteoporosis setting in. Things like that. And obviously these vary from man to man and person to person. So what are the causes of this? What's causing us to lose our testosterone, our sense of manliness, which you really shouldn't measure yourself by how much testosterone you have, but as a man, I get it. So there's tons of reasons why you could be experiencing low testosterone. So I'm just going to throw out a few for the good of the order. So if you're an athlete in any sort of contact sport, and you experience a testicular injury or a testicular torsion, or any sort of infection to that area, it could jack up your testosterone production. So your levels are going to go drastically down in some cases, not drastic in every case. So if you've ever had radiation or chemotherapies, the chemicals that they use and the lights that they use may diminish your testosterone function. Other medications like opioids and corticosteroids, so things like steroid injections, they can cause lower testosterone. Also, any hormonal disorders, if you have a pituitary issue, high levels of prolactin, higher levels of estrogen, you may experience lower testosterone as well. So also chronic diseases, HIV, AIDS, liver and kidney diseases, obesity, sleep disorders. There's a lot to unpack just there. And if you have any sort of genetic conditions, so Kallman syndrome, hemochromatosis, Klinefelter syndromes, things like that are a little bit more geared towards messing around with your genetics. And also, for my lifters, anabolic steroid use. So, this is something that I'm kind of familiar with, not because I've taken them, obviously, but as a trainer, as a wellness coach, you study this stuff. And I do know some people who have taken steroids. So usually when you take steroids, one, it's an intramuscular injection, so your body can absorb the steroids very quickly, right? So what do we see? What are the side effects from using steroids? Your boys shrink. So that prohibits the normal testosterone and sperm production that should be being processed in your body, as well as, you know, acne and mood swings and, you know, things like that. But we're just focusing on the testosterone itself. Next is treatment and therapy. So you found out that you have what is considered to be a low testosterone range. Well, what do you do? Who do you see? Do I see an endo, or do I see a urologist? Or do I see another specialist who deals with specifically just male fertility issues and things like that? So there's different scenarios for different problems and what you want to focus on. It's 2022, right? We have an abundance of different types of protocols and therapies that we can prescribe to patients and clients, and refer people to services that will help them gain some of what they lost back. So the primary treatment option for low testosterone is testosterone replacement therapy, or TRT for short. So this is the most common route most men go in trying to address the needs of how do I get this back, or what steps do we need to take in developing a treatment plan? Things should be addressed before you go in and commit to TRT. So you need to, one, talk to your doctor if this is something that is going to be beneficial for you. The goals of treatment usually for most people, if not all, I'm not a medical doctor, so there's a lot I don't know about how, you know, it varies from person to person as in ways of treatment goals and things like that. But you want to make sure that this is a good choice for you, right? Maintain your sex characteristics, your libido, and you also want to improve upon. So if you go to the gym, and usually if you have low testosterone, you can go to the gym for being very consistent with your workouts and your diet, and everything is on point, but you're really not going to see as much size and bulk that you would imagine. So usually with men who have lower testosterone rates and levels, that's what we see. And as somebody who has low testosterone, this for me was definitely the case. Yeah, I'm toned and, you know, all of that stuff, but I really wasn't seeing size, like formidable size, where it was more measurable by just looking in the mirror. So there's all that you and your doctor have to kind of take in consideration, and they'll help guide you through the process. So depending on the method of treatments, there are injections, there are creams, there are patches, and there's a lot of other stuff that I have absolutely no idea exists. So you have to understand, which, and most men usually do, these treatments are not cheap, and they're ongoing, as long as you want to pursue this line of care. Your body may not be able to tolerate everything that is being prescribed to you. So just because your body is lacking low testosterone and you introduce all of this into your system, it's kind of like when you have a kidney transplant. The doctors have to wait to see if your body is going to accept it or if it's going to reject it. It's the same thing kind of with this. So if your body is rejecting this, you're going to experience some side effects. And from what I hear, they're not fun. So just keep that in mind. The preferred treatments usually are injections, so they can be self-administered, or you go to a clinic or your doctor's office and they administer them for you. So usually it's 1 to every 2 weeks that you administer these shots to yourself. And usually it ranges from about 10 weeks or a little bit longer. The side effects with this is they're very uncomfortable because when you push a needle directly into muscle anywhere on your body, it hurts. So just keep that in mind. And there's also other fluctuating symptoms. You may experience flu-like symptoms, headaches, runny noses, things like that. And then obviously if you're experiencing sort of the rejection route, like I was just talking about, you may be experiencing more chronic and serious symptoms. But like I said, there's also gels, there's also solutions. So it's usually applied to the upper arm, the shoulder, underneath your arm, things like that. If you have skin contact with somebody and their skin absorbs it, they're gonna absorb the some of the testosterone. So there's that. So you definitely want to avoid people for a few hours after you administer the gel or the solution that you have. There's also patches. So it's kind of like the smoking patch, but instead of administering nicotine, it's administering testosterone. There's also tablets. So these are sticky pills that are applied to the gums twice a day. And the absorption through your gums, the testosterone is released in your bloodstream, right? So you might have some, minor or major gum irritation with these. And then there are also nasal gels. Nasal gels. These are applied by a pump into the nostril about 3 times a day. Side effects here, you may have nasal irritation or some sort of congestion. So, like I said, there's a multitude of treatments, routes, and things that doctors can do to administer testosterone back into your body. So there's also another thing that they can administer in a form of a pill. It's called clomiphene citrate, or Clomid for short. So I was prescribed Clomid about 2 years ago. It was right before COVID hit. So yeah, like 2-3 years ago. And so my testosterone levels before I started this was about 270, around 270. So I started taking the Clomid. In about 2 weeks, I went back to my urologist for a follow-up. And he's like, well, your testosterone levels have raised to about 830. And I was like, oh my God, what? So that's a 600 number jump. So that's a lot. And I did feel better. I felt more awake, a little less. You have kind of a brain fog when you have low testosterone. So a little less of a brain fog. I was just more focused. The thing you have to remember about Clomid, it's not approved by the FDA. because it's used to treat symptoms but not the entire problem. So it's treating the symptom, not the cause of it. So it's kind of like you're putting a Band-Aid on a huge wound. So you have to keep doing it, doing it, doing it, doing it. And let me just say this. Once you start testosterone replacement therapy, if you go off over time, your body is going to reset back to some semblance of what it was before you started TRT. Get it? So once all that testosterone gets flushed out of your system, either, by way of, sweat, transfer of, sexual fluids and blah, 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 you are going to feel, in some ways like you did before you started all this stuff. So keep that in mind too. That's my testosterone talk for today. The one thing I want to stress here before I let you guys go and enjoy your Sunday evenings is if you think that you are a candidate for low testosterone, speak to your healthcare provider because they know the best methods to help you gain that back. And like I said at the beginning of this video, when we hit 40, that's when our testosterone levels start to decrease. Now, I'm hitting 40 in 4 months. So, and I already have low testosterone. So, I am totally ahead of the game, which I wish I wasn't, but